Hi everyone, it's me, Allison Dunwald, and this is my infamous speech for my Communication 154 public speaking class. Today I'm going to tell you a little bit about a person who I think is significant to our society. Her name is Lillian Wald. Most of you probably don't know her, but for nurses, she has developed milestones in the nursing profession. She has set the standard for how we take care of people and influenced nurses from all over the world. She was many things, including a nurse, a social worker, and a public health official. Her list goes on for being a teacher, an author, an editor, and a publisher. The New York Times named Lillian as one of the 12 greatest living American women in 1922. She later received the Lincoln Medallion for her work as an outstanding citizen of New York City. Lillian Wald is a significant person in the development of nursing as a profession. She is a graduate from the elite New York Training School for Nurses. During the 20th century, Lillian helped change how nurses practice. She is a pioneer in public health nursing. Wald is best known for the development and establishment of the Henry Street Settlement House located in New York City in the Lower East Side. At the Henry Street Settlement House, nurses were able to provide well baby care, health education, disease prevention, and treatments for acute minor illnesses. It also operated a visiting nurse service, and it has now become the visiting nurse services of New York City. Nurses were able to provide care located around Henry Street so that patients did not have to rely on receiving care at clinics. By 1916, the settlement had 250 nurses and offered health care, housing, education, employment assistance, and recreational activities to the thousands of the city's poor families and individuals. An interesting story that I'm going to talk about is when the influenza epidemic hit New York City in the 1900s. At the time, they knew very little about the disease, and Lillian Wald was at their front lines. The Commissioner for Health of New York City wrote to Lillian to express his appreciation for the nurses' work during the influenza epidemic. He wrote, "The horrific influenza had overwhelmed New York City health officials since it erupted in the city in early September, and Wald's nurses had been instrumental in addressing the epidemic. The nurses were first-line responders, and when there was nothing else that they could do, they provided comfort measures to the people." The epidemic hit New York City so catastrophically that from mid-September to mid-November, there were a reported 10,886 deaths from influenza. Just think how much we know now about influenza and all the advances that we have made since that time. And Lillian Wald was at their front lines when it all started. So not only was Lillian a remarkable nurse, but she established herself as the national leader of social reform and as an international crusader for human rights. She placed nurses in public schools and within corporations. Wald was also an advocate for children and women's rights. She founded the United States Children's Bureau, National Child Labor Committee, the National Women's Trade Union League. Her legacy lives on in New York City, where the Henry Street Settlement House still operates. It provides and offers daycare, health care, and supportive care to more than 50,000 New Yorkers. I chose Lillian as an infamous person to talk about to our society because of her impeccable leadership and her nursing skills. For those of us that are in nurses or in nursing school, she's someone that is or will be learned about. Her dedication, leadership, and civil rights improvements change how we nurses practice today. She has set a stepping stone to nurses in their professions and was able to build and advance healthcare with evidence-based practice. Without her, our healthcare would not be the same as it is today. This concludes my infamous speech, and I hope you enjoyed it, and thank you for listening.